Hello and welcome to our digital parents evening here from the Sana Klinikum Lichtenberg. Today we are recording in English, so our English speaking becoming parents have some insights to our obstetric department. As we are not English speakers, we would like to apologize in advance for any grammar mistake we might make. My name is Maximilian Stern. I'm one of the doctors here. Fortunately, I'm not alone here tonight. On my left side, Yvonne Herrmann, Deputy Head Midwife.
Hello.
And on my right side, Dr. Katharina Aschauer, as well, a doctor here in our department.
Hi and welcome.
All right, we start right away. Kati, what can you tell us about our obstetric department?
Yes, thank you so much. So on the pictures you can see our clinic. The obstetric department will be found in House F, which is also called Eltern-Kind-Zentrum. We're with our delivery room in the first floor, and in the ground floor you will find our outpatient clinic and where we do the registration for birth. We are seeing women and giving birth to about 2,500 children each year. And we are an obstetric clinic that is taking care of newborns that are preterm from 29 weeks. We are starting to give care to babies who are coming. And we are a quite big clinic. We are having around 23 rooms on our ward. And also, we see a lot of women coming in and giving birth. So we will be happy to see you.
See you as well. All right. Okay. So, but first things first. When you're pregnant and you want to come to our clinic, we're happy about it. But how is it working with the registration? Yvonne?
Yeah, if you have decided on our clinic, we would kindly ask you to register in our midwife consultation. We have a midwife consultation from Monday till Friday. You can make an appointment by phone or online. We meet around 4 weeks before your due date, and then we will create your file and clear all open questions, and so everybody feels prepared for giving birth.
Cool. So it's important to bring your mother's pass and stuff.
Of course, your mother pass and your insurance card and all your questions you have.
And all things related to your pregnancy.
Of course.
All right. So maybe there are cases where you would not only be see our midwives, but also our doctors, Kati.
Yes.
When's that going to be?
Yes. So sometimes it's necessary to also see us as doctors. We are doing registration for patients who have kind of a special situation during pregnancy. For example, diabetes in pregnancy. If the baby's in breech position, which means the head is not looking down, it's the butt that's facing down. Or if there's in the medical history, you have a surgery, for example, a C-section, then we would like to see you for a doctor's appointment. We are discussing what is necessary to do. So we're doing examination and ultrasound. We'll discuss what's the plan, what kind of examinations will be done, what kind of follow-up examinations we need. And for example, for babies in breech position, we offer the external version of the babies to cephalic position. But sometimes babies, they don't like to get in the right position. They stay in breech position. And then we also offer that patients can give birth from breech position, which is something that we offer to a lot of patients, and we're happy to also see women giving birth like that. Yeah, so in case something is necessary to discuss with us, you will have an appointment with the doctors also.
Okay, interesting. All right, let's move a little bit forward. Let's say my wife is pregnant around 40 weeks and she's getting belly pain. Whatever that means. So at least we're thinking the birth could start. What are we going to do, Yvonne? Are we calling the delivery room or just coming there? What are we going to do?
Yeah, you don't have to call us before. You can just come. We are there anytime. You can come to the first floor. There's the Kreissaal. Ring the bell. We open the door. And you can come when you feel contractions or the water broke, or you're bleeding, or you simply don't feel pretty well and you would like to have it checked, then come to us and we will check it.
Yes.
So, yeah.
All right, so we ring the bell, you open, what's gonna come up next?
Yeah, correct. Then you tell us why you're here. And then we probably check the heartbeat of the baby. We do a CTG, it's called, to see if the baby is all right. And then probably we do some examinations and we make together a plan of what happens next.
All right. So I think we're mostly seeing the midwives. Are we seeing doctors as well, Kati?
Yes, you will. At least one of them. So as the midwives are the first person or the main person taking care of you, we also have a doctor that is present in the delivery room at all times. But we are taking care of all the patients who are there. So in special situations or when you need us medically, or if you have any questions, we are there to help also. We're also doing examinations. For example, when you're coming in, we would do an ultrasound to check the baby, see the estimated weight of the baby, or discuss with you if anything is necessary. So we're kind of coming in for the special situations or if you need us.
All right.
Yes.
Okay, so let's say wasn't belly pain, it were contractions. So we're staying. Can you show us around in our delivery room?
Sure. Okay, and the first picture, or the last picture.
I'm sorry, we can go back.
Okay, there you can see our central desk. There are all the workstations. We can do our documentary and our monitoring screens. And we have 6 Kreissäle, labor rooms.
Yes.
And in every labor room, delivery beds. You can bring in different positions.
Let's see.
So you can move around to see what feels comfortable.
That looks spectacular there.
Yeah.
Not as boring as my bed at home.
I hope so. I'm not sure, but yes. And we have also up pieces.
Yeah.
Yeah. You can also move to every room. So you can use it anytime to get in different positions to see what's the best for you. We have a mattress to maybe stay on the floor, or we can, of course, we have beds, so you can also relax if you need to. It's everything is possible and totally fine.
So pretty much for persons who want to be more in motion, we have options, and the ones who maybe just want to lie in bed for a while,
it's also possible.
We have possibilities. All right, then what we often hear when we speak to our pregnant women is there a possibility to give birth in a bathtub? Is there a possibility?
There is a possibility. We have a smaller bathtub we can or you can use before to see if it's relaxing for you and it feels good. If it is pretty good for you, you can use the big hot tub and give birth in our big birthing tub. You can also use different positions in there because there's a lot of space, and the warm water mostly feels pretty good against the pain. So you can use it if you want to.
Okay, so first let's bathtub for checking, is that something for me? And then the big one
exactly
to really get in. All right. Okay, you already were saying it helps against pain, so we're hoping not to break bad news here, but birth can be painful in most of the cases, but there's something we can do about it, right?
Yes, that's where we come. We come in as a doctor. So we discuss with every patient individually what they need. It starts with a relaxing bath. Sometimes we are using homeopathy, which is given by the midwives also, and also acupuncture. Some patients like it. We try it if you want to. But also at some point we start with giving medication, of course, which can be an oral medication or an IV, through the vein. We're giving an infusion. Or sometimes patients also say this is not enough. Of course, we have more options. We have laughing gas and also an epidural that we can use to ease the pain during birth. But still, birth will be connected to some pain, and we are here to help.
All right.
Yeah.
Sometimes women we speak to when we're doing ultrasound, they're really concerned if they can get an epidural like every time? So
Yes.
are there office hours at our anesthesia department, or are they here the whole time?
Yes, they're here the whole time, so 24 hours a day. We don't have any epidural-only hours, so we are here to help you at any time.
Perfect. We hope that helps. Okay. Let's say sometimes the midwife has to get out of the delivering room. Are we making sure baby and mommy are doing all right?
Yes. In contrast to the expectant mother, the baby cannot tell us how it feels. So we mostly check the heartbeat and we measure if everything is fine and several other things. And if we're not in the room, we have it on our monitoring screens in every room. So no matter where we are, we can see how your baby is feeling.
Kind of big brother there.
Yes,
Yeah.
exactly.
Watching you.
And it's wireless, so you can also move around with it. So it's pretty good.
Okay, so some births, they don't end vaginally, which is no problem because we have other options. And Kadi, you will tell us about them.
Yes, so some babies, they don't come vaginally, they come via C-section. Then we have an operating room right in our delivery room, which is shown on the pictures now. It's right next to our delivery rooms, which is good because sometimes we need a C-section even though we didn't plan for it. So, and you see the room. We offer that patients are getting a spinal anesthesia during C-section if it's possible, so that they will be awake during the operation, and also that they bring somebody to accompany them during the operation, so somebody's there, the partner, to see if everybody's feeling fine and being there. And what we also like to do, or what we recommend, is that the baby, after being delivered via C-section, should stay with mama if the baby's feeling fine or doing good. We always recommend to bond right away after birth. If it's necessary, then we have our children's room right next door. I will call it children's room, I'm sorry.
The first children's room of the
yes.
life. Yeah.
So the children's room, it contains our children's bed, which produce heat for the babies. In this room, our pediatrics are present if we need them to take care of the babies, to either do an examination or first treatments after birth. And it's right next to the operating room, but also to the delivery room. So we have the option that the partner can be there when anything is being done to the baby. So but our pediatric doctor is also going to talk about this in a few minutes.
All right. So the mother-to-be and the baby are never alone.
They're never alone, yes.
Okay. Perfect. You already said something about bonding. Well, having a C-section, but of course bonding is a big part in vaginal birth as well, Yvonne.
Yes, bonding is very important. Bonding means the early intense development of the connection between the parents and the newborn. Right after birth, we dry off the baby a little bit and then it gets on your chest to cuddle, at least for an hour if the mother isn't possible right after birth, then anybody else can do it, like
Partners.
the partners,
Yes.
yeah, whatever. Mm-hmm. And it's very, very good and important because the baby stays warm and the breathing will get better. Sorry.
Everyone can take a breath then.
Yes, exactly. You cuddle at least for an hour and after that we start the measuring everything. So yeah, and afterwards on the next days, it's also impossible that you really get in contact to your baby.
Oh
so
yeah, we have equipment for that.
Yes.
Also,
I'll tell you later.
You can tell me right now because it's there on the presentation.
Okay.
Yeah.
Oh, very good.
So the most babies come naked to this world,
Yes.
but we can help out.
Yeah. To the bonding top.
Yeah.
Maybe. You get a bonding top. Every family gets a bonding top after birth, so you can put your baby inside, and even if you want to take a little nap, you can still cuddle and the baby can't fall off. And you get a little head. Our knitting grandmas, they are preparing them for all the newborns. And right after birth, everybody gets a little head so they don't get cold, stay warm, because they're losing a lot of
Heat.
over the head. So it's important that they stay very warm.
Seeing this collection, I can imagine it's a hard decision for the parents to pick
Yeah,
one.
they're so cute. And every family gets a T-shirt with "I'm born in the Oscar." That's
Yes.
our hospital. Yes, so it's a little
Giveaway.
Giveaway, yes. And if you want to, there you can get some pictures of your baby. There's a photograph that comes around in the next days and can take some pictures of the very first moments. So yeah, if you're interested, they will come into your room and you can decide if you want them.
All right. And after an hour of bonding, or maybe 2 hours of bonding, I know that parents are getting a little nervous and curious.
Yes.
What's the baby's weight,
Yes.
the length? So what are we doing there?
Yeah, we're doing the first check. It's called the U1. It's the first checkup for the baby. We measure the weight and the length and the head. And we check if it's mature and if there are any malformations.
Yeah.
I'm not
Yes.
sure what the right word. Yes. Yeah, so it gets the first little check, and yeah, then they can leave
All
the
right.
labor station if everything is fine.
There are a couple of other checkups our pediatrician will tell you about later. We're happy about that. And after the first checkup is done and mother and kid are doing all right, they're being transferred to our maternity ward,
Yes.
which Kati will tell us something
Yes.
about.
So our maternity ward, it contains 22 rooms, as I already said, and one room for observing patients after an operation, for example, after a C-section. So 23 rooms actually, and 5 of them being family rooms, which is very comfortable for families staying there together. So you and your partner can stay there with the baby, have a lot of skin-to-skin contact and bond. Here in the pictures, we see one of our family rooms. Yeah, very comfortable. We have like a small area with couch and sofa and some chairs to relax, like a table to eat, get some meals together. And also in every room we have the place to change the baby under a warming heat lamp. And yes, so actually everything you need except for the food. This you will get in the next room you see now. This is the room where sometimes patients are sitting together getting some food, where the breakfast is being displayed, where you can get your breakfast, and also where you can enjoy your lunch and dinner together. And also very important for us and for the patients, some coffee to get. And another special room for our breastfeeding patients or any patient who wants to get out of the room, get to know other patients, and maybe talk a little bit. This is our breastfeeding room or meeting room where mothers or patients can meet, breastfeed, talk about their birth, get in touch also with us. So yes, I also recommend to go there and have a look around.
All right, thank you. Okay, so our hospital is certified baby-freundlich. That means baby-friendly, of course. But what's going on with this? What does that mean?
Baby-friendly means that we support the needs of the babies and their families. So we support them getting into the breastfeeding process, and our whole staff is scheduled in it.
Trained.
Trained,
Certified,
yeah.
yes.
And we have 2 special lactation nurses.
Consultants, yes.
Yes, they have even more tips than we have to get you right in your breastfeeding process. Even though if you don't want to breastfeed, it's also fine, but then you probably need some help afterwards also. So we are here for you.
We do everything that you're a breastfeeding professional after you leave this hospital. All right. Then we have another project. It's called the Babylotsen Project, the German word. So we would loosely translate it to baby navigators. What's that
Yes.
about, Kati?
So actually you could translate it to baby and mother navigators maybe. It's our social workers who support the new families actually from the start, like from the registration for birth. They offer help for like organizing help when you're going home, but also help before the baby's coming. They're here to have a talk, help you, with organization. So we are happy that we have them and that they're helping the young families.
Yeah.
Yes.
That's really great. All right. So obstetrician is not only midwives and gynecological doctors, but also our pediatrician. Pediatricians are colleagues there in neonatology, and we're really happy to welcome our senior physician from there, Tamara Faust. I'm so sorry.
That's fine. Thank you so much for having me. And a very warm welcome also from our children's hospital here at Sana Klinikum. Exactly, we have a large children's hospital here where we treat all the babies or all the children from age 0 to 18 years, and we have a doctor on call 24 hours to see to the neonatology and our NICU. In the best case, you only meet us on day 3 of life for the U2, for the second baby examination, where we meet you and your baby and we do a physical checkup. We check for all the reflexes and see if your baby's doing well, gaining weight, how the breastfeeding's going. We do the newborn screening, which is a test for the most important metabolic and hormonal diseases. It's a little prick in the foot, which we usually try to ease for the babies to do it while breastfeeding. So we have the babies breastfeed, and then most of the time the parents are very surprised because the babies don't feel anything at all.
It hurts the parents more.
It hurts the parents way more, and the babies are unfazed actually. Exactly. So that's what we also do, and we also do a hear screening to check if all the babies are hearing right. And also there, don't be concerned because most of the time, even if it doesn't work, then still everything's good, and we just do a checkup again a couple of days or weeks later because there's some amniotic fluid in the ears or something else is just not working right. And most of the time, the babies do hear very well in the meantime. Exactly, and there are rare cases where the medical condition of the babies needs our immediate attention, so we go into action. We have the children's room, as mentioned, in the delivery ward, where we can attend to the babies right after birth if there's anything wrong. We're a Perinatalzentrum level 2, which means that we treat all babies born from 29 weeks of life or to 1,250 grams. So we try to see the babies in this children's room and stabilize them medically first, and then before we get to the NICU, which is just one floor above the maternity ward and the delivery rooms, we try to have a first meeting of mother and baby so they can have like the first contact even if before we take them to the NICU. And once in the NICU, we have wonderful nurses there who try to take the parents along for everything. They show them how to change the diapers and to feed the babies, to start pumping if the baby's medical condition doesn't allow breastfeeding right away, or even breastfeeding in the pauses between any medical treatment. We do kangarooing, which is like a really nice thing. You take your baby like the kangaroo would in the, I don't know how you say it, sack or whatever, but it's a form of skin-to-skin contact where you just take your baby skin-to-skin in like a lying chair, and you just spend a couple of hours with your baby. We also have mirrors, so even when the baby's on your chest, you can have like the little mirror and take a look at your baby.
So far away from Australia and still kangarooing here in Lichtenberg in Berlin. Remember that.
Just to have like a little bit of normalcy, even if there's something medical going on in the first weeks, which we obviously don't want, but exactly, that's sometimes necessary. And then as soon as we can, with term-born babies who just have like a medical condition for a couple of days, we try to give them into rooming in, which means that if the mothers are still in the maternity ward, we try to give the babies back to the mothers even before the mothers are discharged into their rooms, just to be together 24/7. Exactly. Did I forget anything?
I don't think so.
The most important things are done, right?
Yeah. It's always so great working with you, and we're so happy that we have our pediatricians right at our side, one story above, and there's not a minute they need to get to our site.
I think 19 steps.
19 steps. All right.
Or one elevator ride, right?
Yeah, exactly. Or one elevator ride.
Okay, so at some point, as nice it is in our obstetrician department, at some point you will go home. But if there are any things you need help with, we would like to help you out. Yvonne, can you tell us about the services we have?
Yes, if you don't have a midwife who will come and visit you at home, we have an offer. You can come with your concerns and questions and contact us by email, and we will make an appointment, and so we hopefully can help you afterwards. And we have a Stilltreff where you can get connected with other breastfeeding moms or not breastfeeding moms, doesn't matter, just to get in contact. Yeah, it's pretty nice. And if you have problems with breastfeeding, we have also an ambulance for breastfeeding. You can get in contact with our lactation consultant.
Oh, they're still here, even though you're leaving. You can come back and they're giving you any tip or any help you maybe need. All right, that was what we wanted to tell you. If you have any other questions, please don't hesitate. Write an email to our delivering room. You find it on the website, and then we're more than happy to answer that question as well. And if you're not getting enough of us, what I can understand, then use this QR code and you can look at some videos on our homepage and get some more additional information. All right, we are really happy that you watched this video. We hope we made ourselves understandable in English, and hope to see you and speak English with you when you're coming to give birth in our clinic. Bye-bye.
See you soon.
Bye-bye.
Bye.